Hello future doctors, welcome to Dipenism. I am Dr. Dipen and we are discussing with the mediastinum. In this segment we are going to discuss about specifically the inferior mediastinum and its three subdivisions, that is anterior, middle and posterior mediastinum. Let us first discuss the boundaries. Now the anterior mediastinum has the anterior boundary formed by the body of the sternum. The posterior boundary is formed by the pericardium. The superior boundary is formed by the imaginary plane, which is dividing the superior and inferior mediastinum. The inferior boundary is formed by the superior surface of the diaphragm, and the lateral boundary is going to remain the same, that is the mediastinal pleura. When we describe the middle mediastinum, it has the anterior boundary which is formed by this ligaments, which is known as the Sterno-pericardial ligament, that is the anterior boundary of the middle mediastinum. The posterior boundary is formed by the esophagus, the descending thoracic artery and azygos vein, and the lateral boundary is again going to be formed by the mediastinal pleura. When we describe the posterior mediastinum, its anterior boundary is formed by the pericardium. Also, it contains the pulmonary vessels anteriorly. The posterior boundary is formed by the 8 thoracic vertebrae from T5 to up to T12. So these are the 8 thoracic vertebrae which forms the posterior boundary. And laterally again it contains the mediastinal pleura. So this was the boundaries of anterior, middle and posterior mediastinum. Let us discuss now the contents of the anterior, middle and the posterior mediastinum. So when we discuss about the contents, in the content there are certain common contents which are present, and those common contents from L stands for the lymph nodes. So lymph nodes are one of the common content present in all the subdivisions of the mediastinum. Apart from that, let us first begin with the anterior mediastinum and its content. Then you can remember it as tall. T stands for the thymus gland. Now essentially the thymus gland was one of the major content of the superior mediastinum, but the lower part of the thymus gland also extends up to the anterior division of the inferior mediastinum. Apart from that, A stands for artery. This artery is the internal thoracic artery, and this internal thoracic artery has a small branch which is the mediastinal branch, which is one of the content of the anterior mediastinum. So this is the internal thoracic artery. Apart from this, there is lymph nodes, and other L stands for this ligament. So the fourth and major content is the ligament, which is known as the Sterno-pericardial ligament. So tall you can memorize for the contents of the anterior mediastinum. When we discuss about the middle mediastinum, then in the middle segment, one of the major content is going to be the heart, which is enclosed by the pericardium. So that is one of the major content of the middle mediastinum. Apart from this, VAN stands for veins, arteries, nerves, lymph nodes, and apart from that, in the middle segment there is also presence of tubes. In the veins that are arising are the superior vena cava, so SVC in the middle mediastinum. Apart from that, there are the pulmonary veins which are going to enter. In the arteries that is formed is the ascending aorta. Apart from this, there is also the pulmonary trunk and the two pulmonary arteries. which is one of the major content of the middle mediastinum. In the nerves, the specific nerve that is present is the phrenic nerve, and there is presence of the cardiac plexus that also forms the content of the middle mediastinum. The lymph nodes, tubes, specifically trachea and its bifurcation into the respective bronchi. So that is the part of the middle mediastinum. When we describe the contents of the posterior mediastinum, then in the posterior segment there are contents, specifically the esophagus. There is again van, that is veins, arteries and nerves. In the veins part, there are veins like azygos vein, there is hemiazygos vein and accessory hemiazygos vein which are present. In the arteries, the artery that is present is the descending thoracic aorta. So descending thoracic aorta is one of the content of the posterior mediastinum. In the nerves, the nerve that is the vagi and the splanchnic nerves. Now splanchnic nerves are specifically the part of the sympathetic nervous system, and from the 8 thoracic ganglia there is origin of the splanchnic nerves, which are one of the content of the posterior mediastinum, and the lymph nodes. So this overall summarizes the content of the mediastinum, common being the lymph nodes in all of them and specifically certain major structures which are located. Stay tuned for my next video where we'll be discussing about the clinical anatomy of mediastinum. Thank you from Dipenism.